I'm Samuel Metz. I represent the Portland chapter of Physicians for a National Health Program. As you've heard, too many Oregonians do not participate in a working healthcare system. They don't have access, they pay too much, and their healthcare and that of their families suffer. In contrast, there are many Oregonians who get good healthcare through single-payer systems. Single-payer healthcare is the method of choice for financing employee healthcare by most of the large businesses in Oregon and the U.S. They call it self-funding. It's single-payer. Every government health program is single-payer. For comparable patients, every one of these single-payer programs provides better care to more people for less money than private health insurance. Why should this committee even consider single-payer if we're going to implement the Affordable Care Act? Because the Affordable Care Act will not provide better care to more people for less money than Oregon does now. The Congressional Budget Office estimates that the Affordable Care Act will leave 60 million Americans underinsured or uninsured. We do not yet have a study in Oregon, but we can estimate that there will be 700,000 Oregonians at risk for medical bankruptcy or for death from a treatable disease if the Affordable Care Act works perfectly. The Congressional Budget Office estimates the Affordable Care Act will cost the U.S. $100 billion more each year. We don't have a study yet in Oregon, but we can guess that Oregonians will pay $1 billion a year more under the Affordable Care Act if it works perfectly. It will not improve our health. We know this because in the Massachusetts experience with Romney Care, since 2006, measures of public health in Massachusetts have not improved. Medical bankruptcies have increased 30%, and the costs of health care in Massachusetts are rising faster than any region in the country. When Oregon fully implements the Affordable Care Act, we can expect that health care will remain dangerously inaccessible, our costs will go up, medical bankruptcies will increase, and our public health will remain unchanged. John Prescott is credited with saying, "The best thing about not planning is that failure comes as a complete surprise rather than being preceded by a period of worry or depression." Oregon should plan now. Last question. Will single-payer health care endanger Oregon's coordinated care organizations? CCOs are a uniquely Oregonian delivery system that's currently coupled with Oregon's largest single-payer system, the Oregon Health Plan. These patients are the sickest and most expensive for health care in Oregon, and the reimbursement rate is the lowest in Oregon, Medicaid, financially unstable. With universal single-payer health care in Oregon, any Oregonian can belong to a CCO. The costs to the CCO go down, reimbursements go up, CCOs thrive. In summary, Oregon needs single-payer health care because, one, the Affordable Care Act will leave Oregonians without access, paying too much, and in poor health. Two, because single-payer health care is a great way to make sure that our CCOs not only survive, but that they thrive and compete. And finally, there are no examples in the U.S. of competition amongst private health insurance companies improving access, reducing costs, or improving health. Single-payer health care provides better care to more people for less money than private health insurance. Oregon needs and deserves single-payer health care. Thank you very much.
My name is Mark Kellenbeck. I am the statewide co-chair of the Main Street Alliance. It's a coalition of Oregon businesses, over 1,200 presently, throughout the state. Our members range in size from employers with 400 employees to mom and pop operators, sole proprietors with no employees. 80% of our members have 6 or less employees, so principally small businesses throughout the state. When it comes to health insurance, only 15% of our members' employees presently have coverage, and only 62% of our member employers themselves have coverage. In the past 7 years, the cost of health insurance to employers has doubled, causing them to raise deductibles and co-pays or drop coverage altogether. While the Affordable Care Act is a step forward, it is certainly not a complete answer to small business and most Oregonians' health needs. In 2012, this last year, the Main Street Alliance surveyed 390 small businesses throughout the state, 61% of which said they favored universal or a single payer system that provides coverage to all Oregonians regardless of their work status. A universal health care or single-payer system would not only greatly reduce the financial cost and administrative burden of providing health insurance to small business owners, it would benefit our communities as a whole by creating a healthier and more financially secure populace. The Main Street Alliance of Oregon strongly believes that a publicly funded universal health care system in Oregon, and eventually the entire country, is the only feasible and sensible way to provide health care that every citizen both needs and deserves. The Main Street Alliance of Oregon strongly endorses House Bill 2922 and encourages its thorough review and passage. We thank you for your time and look forward to any questions or comments you may have. Thank you.
My name is Bill Whitaker. I live in LeGrand, serve on the board of Oregon Rural Action, and am co-chair of the ORA Healthcare Reform Action Team. Our action team is working with more than 350 Eastern Oregonians in Union, Baker, Malheur, Wallowa, and Umatilla counties who are deeply concerned about access to and ability to pay for health care for themselves, their families and neighbors, and for all Oregonians. A few weeks ago, an action team member who is a business professor at Eastern Oregon University assigned a civic engagement project to her class of sophomore business administration students. An option for one part of the assignment was to survey 5 persons about their health care and health insurance experiences. 128 surveys were completed. 1 in 3 respondents reported significant problems paying for health care.
My name is Nadine Gross-Kowiak. For 17 years, I had been employed as an emergency trauma RN and have worked in over half the emergency departments in Oregon as an agency nurse. I currently am a very hardworking owner of 2 nursing businesses, and I cannot afford health insurance. The story I'm about to tell you is playing out as we speak. A very nice 58-year-old gentleman presented as a patient at the Corvallis Community Outreach Medical Clinic a few weeks ago with symptoms of increasing weakness and fatigue. I happened to be the volunteer nurse that checked him into an exam room. I took his vital signs, a brief history of his symptoms, and noted that he had significantly low blood pressure. He was then seen by the volunteer MD, diagnosed with a virus, and sent for lab work. He was instructed by the doctor to return in 2 weeks for his lab results and follow-up. He did exactly as was asked of him. He returned to the clinic 2 weeks later in decidedly worse shape. In fact, he was very pale and slumped over on a bench. He was unable to hold his body up. I once again checked him in, took his vital signs, and again noted a significantly low blood pressure. He told me he almost passed out several times during his drive to the clinic. This gentleman was obviously extremely ill, and I requested that the supervisor call an ambulance to transport him to the emergency department. He needed a workup and treatment far beyond our capabilities at the community clinic, and he needed it stat, something I do not ever say lightly. What ensued were long back and forth conversations about the bills he was going to incur from the ambulance and the emergency department. A compromise was made and a taxi was called to transport the patient to the hospital. Not in an ideal situation for a critically ill patient. While waiting the half hour for the taxi to arrive, several of us kept him company and watched him closely. My main concern was that he would die waiting for that taxi. While waiting with him, I asked his permission to tell his story to whoever would listen, and today it is you. He did make it to the emergency department and had a full workup. He was diagnosed that day with esophageal cancer with metastases to his liver. Who knows if this otherwise healthy 58-year-old gentleman could have avoided the progression of his cancer had he been lucky enough to have insurance and the ability to access quality medical care and receive a diagnosis much sooner, or even preventative health care. Desperately sick people do seek medical attention eventually. Usually it is too late. As a nurse, I should never have to decide against what is best for my patients because they cannot pay their bills.
My name is Justin Black. I'm from the Oregon Education Association. We represent over 40,000 educators from K-12 to community college. On average, districts spend 13% of their total budget on health care, and it's an ever-growing percentage. Whatever its virtues, there is growing consensus that we cannot count on the Affordable Health Care Act to significantly reduce health care costs. The administrative costs of private health insurance system, including the cost to providers, will continue to eat up nearly 1/3 of the money we spend on health care. The ACA and various measures that Oregon has taken around health care delivery can improve care and make it accessible to more people. But even under optimum conditions, their fiscal impact measured against the costs of private insurance will fall short of what is needed. Our members want to see everyone someday have access to affordable, quality care that does not depend on employment status, the size of your bank account, or the bottom line. This is an ethical issue. Everybody gets sick, and at some point in our lives, all of us will need care. Children whose families lack the access to care they need or who are reduced to dire financial straits by medical bills they can't pay are not good candidates for success in school. Our members, particularly if they teach in underserved districts, see the results of a dysfunctional healthcare system every day. We encourage this committee We are encouraged that this committee sought to move House Bill 3260 to the floor. We are confident that a study of healthcare financing will show that virtually every other system has shown that a single-payer system is the most cost-effective way to deliver universal, comprehensive care. We hope this committee will not be content with just a study, and that we'll have serious discussions around House Bill 2922. Thank you.
For the record, my name is Reyna Lopez. I'm the Civic Engagement Director of CAUSA, Oregon's Immigrant Rights Organization. We're one of the largest Latino civil rights organizations in the Northwest and mainly work with Latino families. Latinos are the largest ethnic group in the state of Oregon and across the country, as well as one of the largest, fastest growing minorities in the state. But there are significant barriers to accessing healthcare for our communities. The most significant one is the lack of health insurance. This is in part because our Latino community works lower wage jobs, or they work for small businesses that do not offer health benefits. The strong tradition of entrepreneurship is really, really high in our Latino communities, just in terms of the amount of small businesses that come out of these. Nearly 20% of the 6 million people that started small businesses this last year were Latino, and even in my own personal experience, my father owned a small business here in Salem that was never able to offer health benefits because it would have really bankrupt our small business that we had here. So we really, as CAUSA, we really believe that small businesses are going to move our economy forward, and a lot of our members, including in the Latino community, own small businesses. So I'll just wrap it up. Please vote yes on this bill, on House Bill 2922, and thank you for your time.
My name is Kelly Howard, and thanks for having me here. Let's see. I'm a single mother of 2, and I am a working artist living in Lincoln City, and I run a glass-blowing studio that teaches tourists and residents. I also have a gallery, and I sell the work of many Oregon artists. I'm just giving you a little background. I also have a small business with that we provide work for about 6 to 10 people in a tourist-based economy. Sadly, we have not been able to consistently provide insurance for any of our employees or ourselves over the last 8 years. I do have 2 children that I am responsible for, and currently I do have an insurance policy for my kids and myself that has a $15,000 deductible. And I'm sorry if I get emotional over it, because it's a pretty difficult thing to have that pressure on me. So, and anyway, our monthly premium is $451 a month. I don't know why I'm getting emotional, but let's see. Last year I went for a physical to have a checkup and blood test, and my doctor determined that I would have to pay for all the tests through my deductible and suggested that I didn't need the blood tests. My mother was recently diagnosed with colon cancer, so naturally you can understand why someone would want to have those tests done and have it covered by their insurance that they're paying $451 a month for. As a working artist, you know, I know many other craftspeople who cannot afford health insurance. One of these people was one of my very closest friends and colleagues who had a catastrophic stroke at age 57 2 years ago. This man seemed to be in great shape, working out multiple times a week, walking to work, kayaking. He was an amazing asset to the community, but he could not afford to pay the over $600 a month in private health insurance, and the symptoms of hypertension leading to his stroke went undiagnosed. Life-flighting him to Portland, and an over 2-week stay in ICU cost hundreds of thousands of dollars, and now he is a ward of the state and unable to work. All of this cost and loss to our community could have been avoided for the price of 1 or 2 generic prescriptions. What a waste. And that's why I'm here today to appeal to you to institute a decent, affordable healthcare system available to all Oregonians, and to stop the avoidable waste of human life and the incalculable toll of the current healthcare system takes on the communities and families like mine. Thanks for allowing me to speak here today.
My name is Alan Journay. I live in the Applegate Valley. I'm Professor Emeritus of Southeast Missouri State University. Possibly alone among those testifying today, I come from England. Some years ago, I analyzed the advantages and disadvantages of American citizenship and decided that the positives far outweigh the negatives. However, like many other citizens, I would like to improve some aspects of life here. One of these is healthcare. It might be comforting to think that the U.S. healthcare system is the best in the world. However, there are many myths about healthcare both in the U.S. and in other countries where I have lived. The main myth about healthcare here is that it's the best in the world. If best means those with sufficient funds can buy the best healthcare, or physician income is the highest, or the percent expenditure of GDP on healthcare is the highest, then it is arguably the best. However, if we apply criteria that are more meaningful to most of us, a different picture emerges. Applying such criteria, we find, despite its high costs, the U.S. has among the worst health statistics of all rich nations. On a broad international ranking, we stand 37th in overall performance, below Costa Rica, and 72nd in overall health. There are also many myths surrounding healthcare in nations such as Britain, Canada, Australia, and Costa Rica, where I have lived. The main myth concerns the popularity of these healthcare systems. Government-managed single-payer healthcare is so popular that not even the most conservative governments in any of these countries, think Margaret Thatcher, has ever seriously considered abridging it. The second myth is that patients are not able to visit physicians of their choice. They are. A third is that waiting times for essential treatment, rather than elective treatment, are inordinately long. In contrast, the general pattern is that critical care is received on a timely basis. When I lived in Missouri, I was diagnosed with cancer and given 2 months to live, absent treatment. Thanks to insurance, I didn't have to worry much about the cost of treatment, but I did constantly worry about whether the insurance company would approve doctor-recommended treatment. Luckily, the treatments were approved and worked. A sister-in-law of mine, years earlier, was not so lucky. Her insurance company denied treatment, and she died. We often hear the complaint that we should fear government functionaries making decisions on treatment, as though we are better served having insurance company functionaries make such decisions, employees whose income encourages denying treatment and generating a sizable profit. HB 2922 would provide health care for all Oregonians. Publicly funded health care provides everyone with access to health care. No one suffers or dies for lack of insurance. Furthermore, care is available at a much lower cost than the current U.S. system. Health care should not be available only if we are employed or are wealthy enough to afford it. Thank you.
Mr. Chairman, my name is Arthur Innes. I'm a resident of Salem, Oregon. Mr. Chairman, members of the committee, thank you for allowing me to address you today on proposed House Bill 2922, which would provide free health care to all residents of Oregon funded by a compulsory system of progressive taxation. I'm a retired, semi-retired general surgeon. I've practiced in the United States and in the British National Health Service, and I'm therefore familiar with the concept of so-called free health care funded by taxation, and I will not go into the merits of compulsory funding by progressive taxation, which is what this bill proposes. I would, however, like to point out what happens when freedom of choice is removed and the healthcare system is run by a government bureaucracy. As has happened in the British National Health Service, expect something similar to happen in Oregon. Firstly, as a patient in the NHS, the National Health Service, you have no choice of who provides your health care, or the care you receive, or indeed if you receive any health care at all. Wait times to see a specialist or receive a special test, such as a CAT scan, are measured in months. The results are significantly reduced survival rates for all types of cancer and heart ailments, in large part because of delay in diagnosis, as compared to survival rates in the United States. Arbitrary age limits for advanced therapies, such as chemotherapy and heart surgery, are actually and surreptitiously enforced. Under this bill, in the hands of an unelected bureaucracy, best practices, quote unquote, would become the enforcement tool in Oregon. Secondly, as a physician, a steeply pyramidal and paternalistic training system fostered by limited budgets means fewer specialists, and many fully trained specialists with nowhere to go outside the training ranks spend many years in junior positions while waiting for a slot to open due to death or retirement. The NHS controls the number of specialists throughout the country, so many see the writing on the wall early and leave. This bill would create a similar catastrophe in Oregon by destroying any incentive for any physician to stay here. Finally, should you, as a patient in the NHS, require hospitalization, the chance of receiving that care in a hospital that even approaches the standards of care, efficiency, and cleanliness found in any hospital in Oregon are remote. And once the NHS budget for the quarter or the year is exhausted, you're out of luck, unless you have a dire emergency or you have a political connection. This is true of the system in Canada also, incidentally. They prioritize who gets care. Under this bill, Oregonians would be subjected to something similar. What this bill, if fully implemented, will accomplish will be a statewide healthcare system similar to the nightmare of the British National Health Service system, bloated with bureaucracy, anti-patient in every way, and simply unaffordable unless severely limited in access. The accompanying predictable decline in the standard of care generally is not what the people of Oregon will tolerate. I urge the committee to abandon HB 2922 now. Thank you for your time.
Thank you very much, Jack.
I'm Jack Dresser. I'm a psychologist and health behavior research scientist. I've specialized for the last decade or more in the development and evaluation of intervention programs, development and evaluation of the effectiveness of intervention programs. So I certainly look at our healthcare system, not only in Oregon but the United States, with a high degree of skepticism from an effectiveness point of view. But I wanted to address something very, very fundamental today that I don't think anybody else has touched on. You know, we're wearing these T-shirts declaring that healthcare is a human right. So how do we dare to make that assertion? Well, you know, the Declaration of Independence specified life and the pursuit of happiness as fundamental, intrinsic human rights for which governments are instituted. That is the fundamental duty of governments in our Declaration of Independence, is to assure life and the pursuit of happiness, 2 of the 3 anyway. All the other advanced industrial nations recognize this. They all provide universal health care, administered at a national level. And they're not all like Britain's, as which the surgeon was complaining about today. In fact, HB 22 is not a UK-style, universal, national, bureaucratically controlled health system. In fact, we have that kind of bureaucratic control in our private industry, with the decisions made by administrators about who will get what treatment. So what I'm saying is that no healthcare dollars should go to private profits or redundant administrative costs. Our healthcare system administrators should be motivated solely to optimize health outcomes as a public trust, not to minimize costs and optimize profits for private gain.
My name is Lynn Thompson. My husband and I operate and own a You Pick, We Pick blueberry farm just north of Corvallis. The need for health insurance for my family and me has driven my working life for over 20 years. During the majority of this time, my family has either had insurance from my employment or my husband's, but we also have had private insurance and have also been on the Oregon Health Plan, both for a short time. Having insurance is a necessity to ensure that we will not lose our farm should a member of our family have a serious medical crisis. In order to obtain stable, affordable health insurance, I became a food service worker at OSU. I had 2 criteria when looking for employment: good health insurance and summers off. If I had been able to devote more time to our business, we would have been able to expand and improve our farm in a way that is not possible since I am employed full-time off the farm. Not having adequate health care holds back entrepreneurs and small business people. If I had had health care from an affordable source, I would happily resign my position at OSU to someone who needs 1 job while I am working 2. Affordable health care is a quality of life issue. In some cases, problems not dealt with in a timely manner will only have greater costs in the future. In addition to the obvious additional financial costs, these costs include additional days away from work and greater harm to our bodies. The Oregon University System and SEIU, the union covering classified workers, are currently at the bargaining table. And the proposal is that our premium would double from 5%, our copay, or not copay, the percentage that we would pay would increase from 5% to 10%. This would put people in a position of paying even more for health insurance they cannot afford. Having a single-payer healthcare system would improve the quality of life for Oregonians, put employed people to work, allow entrepreneurs and business people to put greater resources into their businesses. I urge you to continue this tradition and allow House Bill 2922 to move forward. Thank you for your time.
Thank you.
My name is Frank Erickson. I'm a board-certified radiologist in Pendleton, Oregon, with ties to the Physicians for National Health Program and Healthcare for All Oregon, supporting universal coverage, single risk pool healthcare reform. I've worked in healthcare since 1977. Served in the Navy, starting with the Health Professions Scholarship Program, and worked in small and large military and civilian hospitals and clinics as an employee, a radiation safety officer, and a department head. I served 2 terms at the pleasure of the Governor of Oregon as the radiologist member on the Board of Medical Imaging. In Pendleton, I now work at a treadmill desk reading medical imaging studies for multiple hospitals and states. In my work, I am tasked to spot disease and offer professional advice on what to do about it. In a broader context, that's what I'm doing here today. I joined the Madisell Doctors on Tour in Eastern Oregon in 2011 and spoke in favor of House Bill 3510 before this committee in March 2011. I've co-authored presentations for the Madisell Doctors Speakers Bureau, which I have placed online at prezi.com, free to the public. This is in my written statement to you. The information gathered there under the titles Healthcare for All Oregon, Single-Payer Healthcare Reform in America, and Timeline of American Healthcare Reform since 1812 provides the background for what I have to say about House Bill 2922. In short, that it is long overdue. It is time for us to stop being a country without a conscience. Being for-profit in healthcare delivery is unhealthy for the patients. The phrase financial toxicity has appeared in recent medical literature. In our best moments, as was recently shown in Boston in the aftermath of the marathon bombing, we demonstrated as a people that we really do care about each other's welfare and will go the extra mile to help those in need. It shouldn't have to cost thousands of lives and cause financial ruin for millions of people to show the faults of our current healthcare delivery practices, but that's what's happening. It's just not as obvious as a bombing. It happens one person at a time, often silently and privately.
My name is Terry Mills. I am a longtime nurse educator, a proud member of AFT Oregon, and a proud member of the Oregon Nurses Association, where I presently serve on their Cabinet for Health Policy. Oregon's nurses make up the largest sector of the healthcare workforce, and year after year, nurses are voted as the profession most trusted by the American public, according to the Gallup poll, and their opinion is valued on providing affordable health care for all. Yet, despite the commitment of every nurse and healthcare provider to provide the best possible care to every Oregonian, our current healthcare system is failing. And this point became especially evident to me when I asked my nursing students at Portland Community College, how many of you have health insurance? Over 2/3 of the class raised their hands and stated they were uninsured. The average age of our nursing students at Portland Community College is 33, so that makes them ineligible to remain on their parents' insurance while they receive their education. It is ironic to me that the people that we are educating to become health professionals don't have access to the care they themselves will be providing. This is wrong. Even in the nursing profession itself, many of my colleagues are not covered by health insurance because healthcare organizations find that health insurance is so expensive, they're choosing to hire nurses in part-time roles to avoid having paid their premiums. Nurses who work on the front lines of our healthcare system are all too aware of how this continuing and growing crisis continues to further erode our living standards, the social fabric of our communities, and the economic health of our country. Patients often access care when it's too late, and we're hearing story after story. AFT Oregon and the ONA support House Bill 2922 because every nurse's focus should be helping our patients get well, not on what insurance plan they have or if the care they need will be covered.
I'm reading for Dr. John Edgar, who is a physician in Florence. He says, "We the people of this country have to agree to some basic rules of civilization in order to live in harmony. One such rule that we have yet to act upon is the basic health care should be a basic human right. Instead, we treat health care as a luxury commodity. We have compassionate care that breaks through in cases of hospice, children, or some of the destitute and elderly. We require emergency departments to stabilize each person who makes it to their doors. But for the most part, we've left health care up to free market profiteering. Free market is the wrong way to view health care, just as it is the wrong way to view police and fire protection. The free market does not distribute designer handbags to people who need handbags. It distributes most of them to people who have far too many already. We as a coherent society ought to deliver health care to places and people who most need the health care, not where it earns the most money.
Hello, my name is Devon Hunter. I'm speaking on behalf of the American Federation of Teachers. We are a union of educators and educational assistants who are tasked with basically building the future of our society with educated students and future American citizens. And my message to you today is that we need your help. The school budgets that we've been faced with every year has been shrinking and getting cut, and a large portion of that budget is going towards health care for the employees. I think someone previously mentioned that there was 13%, and every time we go into bargaining, we're constantly fighting with our employers to try and get better care. The care that we get for that 13% of our budget is usually a very high deductible plan that most people takes large portions of their yearly income just to be able to pay for. And it's causing a lot of people to leave education in search of better employment. So they leave to look for better paying jobs or better paying or better insurance benefits, and a lot of that is in the private sectors, and our students lose every time a good teacher leaves for the private sector. What's really weird and what boggles my mind is that the taxpayers are already paying for the teacher's insurance. They're paying for their health care. They give the dollars to the state gives it to the district give it to the insurance, and then the insurance companies, of course, pass it along to the healthcare providers. That it's weird that we give away all this money to a private industry that is really, they're only interested in fulfilling their contractual obligations that they give to us and pocket as much money as possible. If we switch to a single payer option, all that money that we're giving away to private industry would be able to keep within the public system. We wouldn't be giving up all that money. We could then, the public themselves and legislators would be able to have some sort of voice in how good the care is. They would be able to designate how much money goes towards each individual's healthcare plans. And we could pool all of our money together, that we could, collectively come together as a state to make sure that everybody stays healthy. We've already given for the last, I don't know how many years since I've been alive, the health insurance companies have had the chance to solve this problem of providing adequate health care for people, and they have failed in every sense of the word. People are going bankrupt, people are dying, people are getting inadequate care, and there's just constant problems throughout the whole system. Why don't we give state government a chance? Why don't we give them a shot at seeing if they can actually make something work?
My name is Camilla Marquez. I'm a retired physician who moved to Oregon 2 years ago from New York. I have 30 years of experience mostly working in the public sector in municipal, state, county, and nonprofit clinical facilities. I have experience in both urban and rural settings and have been in private practice. Presently, I reside in Northeast Portland and am proud to count myself as one of Michael Dembro's constituents. It so happens that before attending medical school, I was a graduate student in economics and completed the research for a dissertation in public finance. I can speak to both the individual impact of our fragmented non-system of healthcare on the individual and families. I was a child and adolescent psychiatrist, as well as the significant pressure on public finance that it imposes. Rising costs of healthcare affect families, workers, governments, and all institutions that have a personnel budget. For families, health insecurity presents a double whammy of anxiety about treatment for illness and accidents and the threat of financial disaster from overwhelming costs of disease. You know that most personal bankruptcies are due to medical expenses. I don't have to tell you about the pressure that costs of healthcare place on public budgets. Most of the controversial issues you've been dealing with in the area of finance are indirectly related to healthcare costs. Imagine how your lives and careers would be if you did not have to contend with these pressures. Imagine how the lives of your constituents would be without the threat of health and financial insecurity. As we have seen through the course of the Great Recession, no one is immune from the devastating impact of the loss of employment and health coverage. Communities are in turmoil as their budgets are crunched by the demands of health care coverage. Labor and business are in constant tension over these issues in their contract negotiations. In order to deal with the problems of rising costs, we see the insurance industry, healthcare providers, and employees resorting to consolidation of their market power in order to try to dictate the terms of costs in the marketplace. One thing is certain in this competition for dwindling resources is that the people who need or may need care, the patients and their families, come out on the short end of the stick. Higher premium costs, fewer services, reduced reimbursement, and stressful employment circumstances for workers. This would all go away with the passage of the Act for Affordable Health Care Plan for All Oregon. Everyone would be covered. No longer would people have to worry about the financial impact of health care, and the greatest of all for the entire community, budgets of institutions would be relieved of the pressure they face. Tuition increases in higher education would be moderate. Adequate staffing of public schools would be possible. Municipal budgets would not have to face the decision to cut valued programs for the sake of maintaining minimal standards of public welfare. I plead with you, for the sake of our communities and your constituents, to support and pass this measure. Thank you.
My name is Lee Mercer, and I'm a small business owner from Silverton, and I'm part of the executive team of Main Street Alliance of Oregon. I'm speaking as a private citizen today in support of HB 2922. Last June, and 70 years after he hit Utah Beach, my father died of cancer. A year before, he completed his memoirs, a proud narrative about the greatest generation. In it, he describes serving in World War II, raising his family, and working in the aerospace industry. It is mostly a cheerful tale of a life of a member of the greatest generation. One chapter, however, dealt with darker moments. After retiring, his dreams of travel and relaxation were dashed when, due to questionable medical diagnoses, my mother experienced a breakdown. She suffered for 15 years from a combination of mental dysfunction and seizures. For 15 years, my dad served as her nurse, cook, and housekeeper. When she finally died, he was bitter about the American medical system, a system which he felt had become so uncoordinated that doctors are often acting in ways detrimental to their patients' health. He concluded with a plea: I think this medical system is crueler than Hitler and any of the worst tyrants of history. Our broken medical system must be fixed. This chapter was shaped as a letter to President Obama. He sent it also to the Surgeon General and John Kitzhaber. Neither the President nor Surgeon General replied, but Governor Kitzhaber did in a handwritten note which brightened my father's last days. It gave him hope that indeed someone was working on changing the status quo in America's health system. Kitzhaber wrote, Dear Mr. Mercer, thank you for your book and your letter. My late father was a member of the greatest generation and served in Patton's army in Europe. I used to call my father every June 6th on the anniversary of D-Day to thank him for saving the world, because that is exactly what your generation did. I was also touched by your story about the shortcomings of the U.S. medical system. I'm deeply committed to reforming our healthcare system to increase coordination and shift the focus to prevention and wellness. Thank you again for your book. Warm regards, John Kitzhaber. And indeed, Kitzhaber is overseeing bold moves in healthcare reform. Cover Oregon, the new Oregon Health Insurance Exchange, is outpacing most of the other states' programs and preparing to take applications for small businesses and uninsured individuals in October. And further, the development of coordinated care organizations will begin moving us from pay-for-service to an outcome-based model where prevention and maintaining health will be incentivized with projections of decreased healthcare costs. But my dad, a child of the New Deal era, felt that true universal health care was the final victory needed for health reform in America. Being from the generation that built Social Security, Medicare, and America's middle class, he felt that a system would never be complete till we reached a true everybody in, nobody out type health system. So in terms of paying the debt Governor Kitzhaber and I and a number of us in this room owe to the greatest generation, I'm sure my dad would be glad to know I and thousands of Oregonians are asking our legislature to pass the Affordable Care Act for All Oregon Plan, HB 2922. As aging baby boomers, we may be a little late starting to pay this debt, but there is no time like the present to start. Please vote for this.
I'm Dr. Joe Usterman, now living in Wilsonville, one of the 6 founding Matis Health Doctors of Oregon. in 2009, just in case you didn't notice. Just one of the reasons we mad as hell doctors are mad as hell is the number of Americans, approximately 40 to 50,000, and Oregonians estimated at 660, who die needlessly each year, not to mention the even greater numbers who suffer ill health needlessly in America. With respect, in my opinion, the current huge efforts using the community care organization incremental approach to fix the terribly inept healthcare non-system in Oregon has already clearly proven to be, as predicted, fractured, and recently more and more contentious, particularly over issues of transparency. House Bill 2922 is the solution. Thank you.
My name's Chris Wigg. I live in Eugene, and I'm the vice chair of the Democratic Party of Lane County, and I'm here today to represent that organization. There exists an acute need for an affordable healthcare delivery system for the working families in our state. In the 12-month period that ended in March 2013, more than 14,500 Oregonians filed for bankruptcy. The American Journal of Medicine has reported that more than 60% of bankruptcies are a result of medical expenses. And so if we put two and two together, that means that 8,700 Oregonians went bankrupt because they couldn't pay for medical expenses in the last year. I think that's unacceptable. I'm pretty sure you guys all think that that's unacceptable, and that we can do a lot better than that. I think it's important that the perspectives of 89,000 Democrats who live in Lane County are represented here today. Lane County Democrats believe in a single-payer healthcare system, and we're proud of our elected representatives. We believe in all of you guys. We believe in you to make single-payer healthcare available to every Oregonian, whether it's via this bill, whether it's the bill tomorrow that we're talking about with the pilot program, or whether it's a bill in the next session. We know you guys are going to do the right thing, and I wanted to thank you for allowing me to speak to you today. I look forward to working with you to create a healthier Oregon. Thank you.
Thank you.
My name is Bud Laurent. I'm the chair of Mid-Valley Healthcare Advocates, and I appreciate the fact that you're holding this hearing today and that so many of you showed up, I think all of you at one time or another, to participate. While Mid-Valley Healthcare Advocates understands that this is a courtesy hearing with no subsequent action intended, many of our advocates will be in attendance, as they have been, filling up this room and two others, to express our support for complete healthcare reform in Oregon that leads to what many refer to as a single-payer system. Our advocates, and there are growing numbers of them, are convinced that a well-administered single-payer system, much like a Medicare for all, is the only thing that makes sense, humanely and fiscally. Oregon is on a path to healthcare reform, currently limited to lower-income Medicaid patients, for which we applaud the legislature and other state leaders for enacting. Within the promise of the newly created coordinated care organizations lies the possibility of a much-needed change in the delivery system in the form of patient-centered primary care medical homes. When successful, and they must be successful, these new medical homes will become a model that Oregon will be proud of and that other states will emulate. While these are estimable achievements, Mid-Valley Healthcare Advocates knows that they are only a beginning. To achieve fully reformed healthcare in Oregon, we need to pass a bill like 2922, and we're grateful for the 24 representatives and the 3 senators who have signed on as sponsors and co-sponsors of the bill. They are heroes to us. We look forward to a time at a not-too-distant day when there are solid majorities in both state houses in support of single-payer health care for all Oregon. You will know that day is coming when more Oregon cities join Corvallis, where Mid-Valley is centered, in adopting resolutions in support of single-payer health care like Corvallis did 2 years ago in 2011. I've attached a copy of that resolution in my submitted remarks to be included in the public record. And Corvallis, a city on the forefront of in America for sustainable practices, understands that true sustainability also requires equal access to affordable health care for all. We are grateful for the foresight and leadership of the city of Corvallis, and we look forward to the time when the rest of Oregon catches up, including the state legislature. Thank you again for holding this hearing. Mid-Valley Healthcare Advocates looks forward to a hearing on HB 2922 or a successor bill, which will move Oregon forward to a complete
And I don't need to repeat what's already been said today. A lot of it has been said. But what I want to do is I want to really encourage you to go back and speak with your family members, your neighbors, your friends, and you'll probably find the same thing that I find, which is I know far too many people who do not have any health care insurance at all. They can't afford it. I know far too many people who are small business owners. They're individual contractors. They run small retail outfits. They are their own employees. They cannot afford health insurance for themselves, let alone afford health insurance for their employees, if they have any. I know far too many people who I've known over the years who have put off getting medical treatment or even going in for any kind of examination or any routine treatment or test because they can't afford it. And I know far too many people who put off getting any tests done because they worry that if they get the test done, it will then lead to costly treatment. And so they put it off, they don't do it. I've known far too many people who have put off undertaking any of their medical treatment because they can't afford the medication. They can't afford the prescriptions. I know far too many people who had to decide in their own family which of them were going to be treated or which of them were going to be covered by insurance. They had to choose. One would be covered for a few months so they could get their medication for a while. Then they would switch to the other one so they could be treated for a while. And I've known too many people who have family members who have died because they couldn't get the treatment that they needed. If you're like me, you go and talk to your neighbors. I find people don't want to talk about personal issues unless you really get into a conversation with them. Then you'll discover people that they've had family members die. They've had family members go without treatment. They've had family members go without any kind of diagnosis because they just don't want to undertake it, or they don't want to be liable to that cost because they know it'll come up, or they don't want, or they can't afford the diagnosis in the first place. So I really encourage you to go back, talk to your families, friends, and neighbors, and you'll find the same thing I've found.
Thank you.
My name is Karen Josephson. I'm from Corvallis, and I did not intend to testify today, but I get fired up. And I was in a representative's office, and it was said that if we pass this, how are we going to have enough doctors to see everyone? We just don't have enough people even in training. And you know, this is just common sense. And I thought, well, I've got to at least state this, because if we took this system and we shifted the energy in it towards prevention, when you do prevention, you don't need a doctor that's had all that training to sit and talk with somebody about the sometimes common everyday things that we need to be doing for prevention. We all know what they are. We all can't do them because sometimes we were raised in a family that didn't give us the role modeling for the right food or the right health habits. Those kinds of prevention things, we need to work on those with everybody. People can do that are lower cost health workers. And so that would take care of all of that need, and the people wouldn't be moving along into the system where they're really ill and need to see a doctor. And at the same time, we would see them when they, like the example that was given about the symptoms of hypertension and the person who needed a thyroid medication, that kind of lingers on and on and on, and of course it becomes worse. And then the ugly thing here is this health insurance industry sitting right in the middle of it as a gatekeeper, not providing any straight away health care, but saying yes, no, later, yes, no, and raking in the profits. So if we just kind of shifted all that way, that would take care of a lot of that. I wanted one more thing, is the fear that is created. I really respect the woman that was up here that talked about government takeover. She has a right to all of that opinion, but I want to say government takeover is a phrase that you hear a lot. You hear it on the federal level, you hear it on the state level. You hear rationing, you hear stealing our money, you hear tyranny. But when I talk to somebody, is the government in their lives and how is the government in your life? They can't tell me. So these fear messages are well created by the big corporate power that's sitting silently in the middle here, taking all the money and not providing anything that we need. And and so this is the moral thing we need to do, is to pass this Health Bill 2922.
My name is Lucinda Heights Claybaugh. I live in Forest Grove, Oregon.
I've lived there for 23 years. I was teaching in 96, 97, and I couldn't see the board one day, and so I went in for an eye test, and I went to OHSU. They sent me to the National Eye Institute in Bethesda, Maryland, where I was diagnosed with bilateral, both sides, transilluminating essential iris atrophy. My irises are atrophying. I have huge holes, thousands of little holes that are turning into bigger holes. They let in a lot of light, and that gives me migraine-like headaches. They don't know exactly what causes it. At least they didn't in '98. They said, wear sunglasses, dark sunglasses, so you don't have quite as bad a headache. That's the only thing they were able to offer me at the National Eye Institute in 1998. I don't know whether there will be anything that will be able to prevent me from going blind. The 6 people that have this condition bilaterally that I'm aware of in the United States don't have a lot of hope. This puts me into the high-risk group for care. I eat lots of carrots. I teach yoga. I lead a healthy lifestyle. I meditate. I try to do the right thing in many ways in my life to take care of myself. But I don't know that there's anything I can do about my condition. I lost my insurance through no fault of my own. And now I find myself unable to pay for the high-risk pool. I'm unemployed at the moment. I was working for $10 an hour during the tax season for H&R Block, but that's over. And even at the height of the tax season, working part-time at $10 an hour, I wasn't making enough to pay for the monthly cost of the high-risk pool in Oregon. I don't qualify for the Oregon Health Plan. There's a huge gap between how little you can make and get on the Oregon Health Plan and what the high-risk pool is. We're talking at the minimum $700, some almost $800, up to $1,200 a month. I wasn't making that with $10 an hour. That's a lot of money to expect anyone to pay. I know that I will cost some at some point to some people. I think it would be better for the extended or expanded healthcare programs to exist that could help people such as myself.
Can I ask you to wrap it up, please?
That's it.